Hi everyone, my name is Devina, and today I'll be discussing a topic that I personally can relate to, and that is treatments for ADHD. Before I begin, I would also just like to let you all know that I have been a little under the weather this whole week, so if I sound a little stuffy, I apologize in advance. But without further ado, let's jump into the topic I chose. I chose this topic because I was properly diagnosed with ADHD about a year and a half ago. I've always shown symptoms of this disorder, but it was not until I got to college that it became really prevalent. Because of this, I wanted to do more research into ADHD and look into potential treatments because I've encountered many struggles with finding the best form of treatment for myself. Because of this, my research question is focused around what is ADHD and which treatment options are best in addressing the primary concerns with those diagnosed for ADHD. So, to start off, ADHD is a neurodevelopmental disorder, which is a group of disorders in the functioning of the brain that emerge at birth or during very early childhood and that affect an individual's behavior, memory, concentration, and/or ability to learn. The three most common examples of neurodevelopmental disorders include ADHD, autism spectrum disorder, and other intellectual disabilities. ADHD, or attention deficit hyperactivity disorder, is a disorder marked by the inability to focus attention or overactive and impulse behavior, or both. There are four main criteria for individuals to be diagnosed with this disorder. The first is that, for 6 months, the individual displays at least 6 symptoms of inattention or symptoms of hyperactivity and impulsivity. Symptoms include disorganization, getting easily distracted, failing to listen to others, in constant motion, and much more. The second is the individual displays symptoms before the age of 12, and while I was diagnosed after I turned 12, my parents were aware of the symptoms when I was younger. The third is that the individual displays symptoms in more than one setting, and the fourth is that an individual experiences impaired function. In general, people with ADHD may have characteristics such as learning obstacles. An example would include developing the ability to speak later in your childhood, improper interactions with peers, difficulty controlling emotions, lacking good judgment due to impulsivity. Their mind may be in several directions at once, or they tend to perform very well with specific activities and not in other specific activities. In regards to causes of ADHD, research has shown that ADHD is mostly biological. It is highly genetic. My dad had learning disabilities, including ADHD, and it's also dependent on a balance between something called type 1 attentional process and type 2 attentional process. Type 1 includes voluntary control and focus of attention on unexpected things that occur in our surroundings, while type 2 includes mental activities that we control and involves our effortful focus on attention. The balance between the two is maintained by a number of structures called the attention circuit, and it is necessary that the two work together, otherwise disorders like ADHD may be present. In regard to treatment options, the first one is going to be medications. So, with medications, there are two types of stimulant medications. The first is methylphenidate, better known as Ritalin and Concerta, and commonly used to treat ADHD. Effects of this medication include ability to help an individual focus, solve complex tasks, perform better in school, and control aggression. The other stimulant are amphetamines, also known as Adderall, and this stimulant is increasingly prescribed for children with ADHD, and the effects are very similar to those of the other stimulant. The primary difference between the two stimulants are that the side effects that they result in. For me, I personally had worse side effects for one type versus the other, but it completely depends on the patient, and side effects could include things like issues with sleep, increased anxiety, depressive symptoms, and more. In regards to cognitive behavioral therapy, operant conditioning can be performed by parents and teachers, where the child is rewarded for attentiveness and self-control. A token economy program can be used where a student is given a token as a reward which later can be used as an exchange for greater rewards. Other options include an 8-week therapeutic summer camp as intervention that's done in a classroom setting, or parent management training, which is family interventions combined to help effectively approach their child. This can also be combined with school intervention. An example of this would be called daily report card, which monitors a child's behavior by examining their behaviors as satisfactory or unsatisfactory by the parents at the end of each school day. Behaviors could include how attentive the child is in class, if they raise their hand before speaking, and more. While both treatment options may be beneficial, a combination of medication and therapy treatments is most popular. Many people may combine the two because it results in lower levels of medication, which can help an individual avoid undesired effects, and because it's believed that just medication alone is not meaningful in the long run or to positive changes in peer relationships or family dynamics, since it's a short-term solution, so combinations may be better. Studies have also shown that a combination of treatments is more effective for 70 to 80% of people that have tried it. Since medication and therapies can be very costly, another less used and explored option are non-traditional alternative treatments that can also be used as complementary treatments. So examples could include chiropractic, homeopathy, and acupuncture. A study evaluated these non-traditional alternatives and measured factors such as parental concerns of children with ADHD and more to determine how likely people are to use this form of treatment. In the study, they determined that 5% of parents with students who have been diagnosed said they looked into an alternative treatment. That study was done at a school for younger children, and while many do not choose this option, and there is no scientific proof that is effective, it may be more cost effective and could be beneficial. Lastly, I would like to discuss concerns regarding comorbidity. Comorbidity is essentially when an individual has more than one disorder, and it's important for psychologists to evaluate and consider this when diagnosing patients. Factors that could be potential issues include disorders could fall on a continuum, overlapping clinical features lead to misdiagnosis, splitting of a single syndrome could lead to comorbidity, and people with the two disorders are more likely to be referred to treatment than those with one disorder, so it may be just exaggerated. Common examples are with ADHD are mood and anxiety disorders, aggressive behavior, OCD, substance use disorders, sleep issues, and more. I personally struggle with anxiety, and this was something that my psychiatrist had to consider in regards to choosing the right type of medication and also when diagnosing me with ADHD. In conclusion, I would say that choosing the right type of treatment depends on the individual, and there are many options for the individual to explore. It's important to address that any type of disorder, no matter how severe it is important to be aware of. And I hope that you all were able to learn something from the treatment options of ADHD and about ADHD in general, and I look forward to hearing your responses. If you're interested in finding more information or checking out any of the resources I used, they're also provided right here on the last slide. Thank you.